Greetings from Aster RV Hospital. I'm Dr. Shivani Chandan, consultant obstetrician, gynecologist, and laparoscopic surgeon at Aster RV Hospital, Bangalore. In this video, I'm going to talk about a very important topic, that is emergency contraception. Contraception or birth control methods means the deliberate use of medications, devices, or surgery to avoid or to prevent a pregnancy. Emergency contraception refers to methods that are used to avoid a pregnancy but after having had unprotected sexual intercourse. Now, what are the situations when you can use an emergency contraception? The first is if there has been an accident such as a rupture of a condom or slippage of a condom during the act of intercourse. The second is if you've forgotten to take your regular oral contraceptive pills or your regular methods of contraception. The third is if you've had intercourse accidentally or you want to avoid a pregnancy after having intercourse. Now, what are the different methods of contraception available? There are two different types of emergency contraceptions that you can use that are safe. The first is intrauterine copper device. Normally known, some people in Canada say loop. So a copper T is one, and the second is contraceptive emergency pills. Let me first discuss about the intrauterine device. Now, this device, if used as an emergency contraception, should be inserted within 5 days of having had unprotected sexual intercourse. So for this, you need to consult a doctor. It is done on an outpatient basis. The copper T should be inserted within 5 days. The additional advantage of getting a copper T inserted is that it provides ongoing contraception, because these copper Ts can be kept for 5 years up to 8 years. There are different devices which can be used for different durations. So that is the additional advantage. There is no major drawback, but sometimes certain patients may have little pelvic pain, cramps during the first 2 cycles. The bleeding may be slightly heavy, but apart from that, after 2 to 3 months or about 6 months, patient gets very comfortable if the copper T is inserted. And for these side effects, medications are available. So this is one of the easy methods, but you need to consult a doctor to use this method. The next method is the emergency contraceptive pill. Most commonly available over the counter, it is called the I-pill or sometimes unwanted 72. So this pill should be taken within 72 hours after having had unprotected sexual intercourse. The earlier you take it, the better the outcomes. This provides contraception by preventing ovulation from happening. You can just pop it, you don't need a consultation for this. But remember that if you miss your periods after having taken a pill and your urine pregnancy test comes positive, you need to consult a doctor. This pill should be taken only on an emergency basis and not on a regular basis. It's not that you have intercourse each time and each time you take the pill. It doesn't work like that. This should be used only on an emergency basis. This pill can sometimes cause vague dizziness, little abdominal cramps, little spotting. You may have the next period may be slightly irregular. Rarely, it is also known to cause ectopic pregnancies, that is pregnancies outside the uterus, particularly in the tube. And hence, even after taking an emergency pill, if you don't get your periods within a week of your expected due date, do a urine pregnancy test. If it turns out positive, you must consult the doctor immediately. So these are the two methods that can be used as emergency contraception. For copper T, that is intrauterine device, you need to visit the hospital so that we do a checkup and insert the copper T. As I mentioned before, this is an outpatient procedure that has to be done without anesthesia, but involves putting a device inside the uterus. We observe you for a couple of hours after putting the copper T and then you're sent home. Whereas the pill can be taken over the counter. But any side effects, any issues, you need to visit your gynecologist. For any further queries, do visit us at Aster RV Hospital.